You might also want to remember some sunscreen. With more than 5 million cases in our country every year, skin cancer is the most common form of cancer, but also the most preventable. And if you take a look in a store for just a moment, you see how many different products there are to help you prevent it. But we want to find out what works and what really doesn't work. It's a waste of your time and money. Joining us live to help us out with that is Dr. Sherry Ingraham from Advanced Dermatology. Good morning to you. I'm really glad you're here to talk to us about this, but I first want to ask you, when we're checking our skin at home, which we should do on a regular basis, what should we be looking out for?
So you want to look for the A, B, C, Ds, and Es. And this is a wonderful tool the American Academy of Dermatology just put out. It's a bookmark you can order from them. But what this shows is you're looking for asymmetry, changes in the border, changes in the color, changes in the diameter or evolution. If a flat lesion becomes raised, becomes itchy, bleeds, if there's any kind of significant change, even in a mole you've had your entire life, it needs to be seen by a dermatologist and evaluated, because early detection leads to early treatment and is often curable.
And a lot of skin cancers like basal cell are going to be in those areas that just soak up all the sun all the time, like our face or our hands, top of the head. But what about melanoma? It can be really tricky and lurk in hidden places, can it?
Yes, melanoma is a very interesting type of skin cancer because there's a large genetic component. So if you have a first-degree relative with melanoma, you want to remind them everyone in the family who's a first-degree relative needs to be checked annually. And on yourself, you want to look between your fingers and your toes, because it's more of a genetic disease and can be associated with skin exposure to the sun. You have to look where the sun shines, but also where the sun doesn't shine. So have your hairdresser look in your scalp. Have your eye doctor look in your eye. Ocular melanomas do occur. It can occur in the mouth, and it can occur in the genital area. And we've seen them in all of these places. And oftentimes, those are the most deadly because they're the ones that are found, unfortunately, later on. And again, early detection is key, and having these not cause a lot of morbidity and mortality. So get your family, get your other doctors, get your gynecologist, get your urologist, get your hairdresser involved in looking. But most importantly, do those self-skin exams and have a loved one help you do that exam so you can document and follow your own moles.
And we can get high tech with this. There's an app for that, of course, so you can actually, it'll help walk you through and keep up with your skin.
Yeah, the University of Michigan has a great free app. I've been playing with this app, and on this app, you can actually take photos of each limb or have someone help you take photos. Then you can put where each lesion is, measure the lesion, and then track it. And then when you go into your doctor, you can say, you know, I've been following this lesion. I think it's changed. So that really helps you kind of stay engaged. There's other apps. There's actually an app called Mole Mapping. If you go to molemapping.com, that comes out of Oregon, the University of Oregon, where they're actually accumulating data on moles from around the country that are submitted through these photographs to try and have better kind of AI or artificial intelligence ways of tracking these lesions so we can detect skin cancers earlier and earlier. So these are a great tool that you can use on yourself and on your children.
Now, I'm a big fan of UV clothing. Do you think it works?
I am a huge fan of UV clothing. You know, I tell my patients every day, when you drive home from work as a woman often, you'll even notice by the time you get home, through the long wave UVA penetrating through that glass on your windshield, tinted or not, it will penetrate. You can even see a demarcation from just driving in your car at the end of the day in Houston. So if you can wear a sun protective scarf in the car, keep it in your, glove compartment. Sun protective shirts are fantastic for men, women, and children. There's nothing better than putting a sun shirt on your kid and not having to reapply sunscreen, even though we have zinc-based, really strong sunscreens that are excellent on the face that you should put on every day. Reapplying sunscreen when a kid is getting in and out of the water, or you are, can be tedious, and then you can lead to getting sunburns. And we now know that getting more than several blistering sunburns leads to melanoma in adulthood.
Dr. Ingraham, so helpful. Thank you for raising important awareness and hopefully saving people from a lot of drama with skin cancer. Good to see you.
Thank you.